From MTN, the Montana Television Network, this is Face the State.
Hello and welcome to this week's edition of Face the State on the Montana Television Network. I'm Mike Dennison, MTN's Chief Political Reporter. We're on location at the Department of Public Health and Human Services in Helena. Today the subject is not politics. It's the biggest issue facing the state, the nation, and the world: the COVID-19 novel coronavirus pandemic and outbreak. In 4 short weeks, we've seen how this pandemic has altered and disrupted everything in our daily lives here in Montana and across the nation. No doubt you have many questions about how this is affecting the state, what the state is doing, what you can do, how it's impacting Montana businesses, and all sorts of questions across the spectrum. To help me address those questions today, I have 2 guests. Major General Matt Quinn, who is head of the National Guard in Montana and is also chairing the Governor's Task Force on COVID-19, and Todd O'Hare, the President and CEO of the Montana Chamber of Commerce. Gentlemen, thank you for joining me today on short notice this week. We're going to start out with Major General Quinn. So far, we've had a relatively few number of confirmed cases of infection of COVID-19 across the state. Is that amount going to increase? Is it fair to say it's going to increase? By how much? What's the best case scenario? What's the worst case scenario?
Yeah, Mike, the number is going to increase. I think every prediction is that that number will increase, and we'll probably see it increase daily. As to how large it's going to go, I don't think anybody in this nation or in the world knows how large this is going to go. Certainly there's steps that we're looking at, which I think we'll talk about, but where that number goes depends a lot on what we do as a state and what we do as a public.
Yes, and that's kind of my next question, but we'll come back in the show later on and talk about, how Montana sits relative to the rest of the country, what we can predict about that, if we can predict that. But first of all, let's talk about the steps that the state has taken so far, and local health departments and other institutions in Montana, to slow the spread of this disease, to flatten the curve, as we're saying.
Yeah, Mike, this is something that we've had to look at as a state, but also every local public health department is engaged on this to protect the citizens of Montana. And so as we look across the state, there are actions certainly that Governor Bullock has directed, but there's also actions that the counties have directed out there. And so I think the number one that we've talked about as a state and as counties is social separation. And that is increasing the distance between our citizens of Montana to limit the spread of COVID-19.
And when you say social distancing, I mean, here we are sitting here, we're 6 feet apart, and tell us more about what social distancing means in our everyday life.
Well, COVID-19 is spread through viral and through contact. And so what social distancing means is to increase that separation between parties. So one of the things that Governor Bullock has talked about is stopping social gatherings. And he's talked about stopping all social gatherings. Some of the numbers that have put out there are any social gathering greater than 50. But I think the intent of his message is, listen, we need to look as citizens as how we are gathering as a people and try to decrease the amount of those gatherings or stop those gatherings. That's the most effective way to limit the spread of COVID-19. And we talk about trying to cut that curve down or to limit the curve so that we don't get a large peak as other nations saw, certainly as we watch China unfold and we're seeing Korea and Italy unfold. We want to lessen that peak to ease our hospitals and clinics, and the best way to do that is to limit those social gatherings and limit or increase the separation between people. And
right now, as you said, that's not an order from the governor. That's a recommendation from the governor that this is what people need to do, correct?
That's correct. Yeah. It is. I don't know how the governor would order people not to gather, but it's the recommendation that I hope all Montanans are listening to and across this nation.
And of course, the governor has also ordered schools being closed for at least 2 weeks. And as far as the orders on bars, restaurants, et cetera, which we'll talk about briefly here with Mr. O'Hare, that's coming down from public health departments, local public health departments, not the state.
That's correct. There's been a number of local public health departments that have made the determination that they want to limit people's access to bars and restaurants and other places where they can congregate.
Okay. Todd, let's talk about some of that. Now, some of these steps, of course, as you know and we know, are affecting many types of businesses, restaurants, bars, gyms, but really, I mean, all types of businesses, because people are being told to stay home, not to go out. What's happening out there, and how are businesses reacting to this severe economic disruption?
Well, it depends on what business you're in, you know, what industry, and some of them are experiencing some pretty severe, dramatic, immediate impacts to their business. If you're obviously in the restaurant or the bar business and your business has been ordered to close down by the local health department, right, you're seeing those sort of immediate impacts. And it's not only the impacts to the businesses, it's also to their employees. And so we're seeing a real serious impact to those sort of businesses. Other folks in the hospitality industry are starting to suffer some real serious impacts, as we've seen travel limited in the state of Montana. We've seen conferences that are in-state conferences and meetings, those are being canceled and postponed. And so we're seeing some real serious immediate impacts in the hospitality business in Montana. Other businesses have got other sort of impacts that they're working through. You know, everything from a slowdown in demand for their business to having to deal with employees that suddenly woke up on Monday morning and recognized that they had children that were school-age children that weren't old enough to stay at home by themselves. And so, you know, how do businesses deal with those sort of employees that are calling in and saying, I need to stay home with my kids because my kids are now out of school? So there's a myriad of effects that are applied across all the business sectors in the state of Montana, some substantially more dramatic than others.
And now, we've read about some rather large layoffs in other parts of the country. I'm wondering, are we going to see mass layoffs of employees in Montana, people not being paid? Is that going to happen?
Well, we hope not. And obviously we're starting to see some of that with restaurants and bars and some of those directly in the hospitality business, because they're having to make some very difficult choices about the amount of reserves that they have on hand. And you know, you have no income coming in your front door, but you've got ongoing expenses that you have to meet. And so I think there's a dramatic effort underway by some of those businesses to try to preserve cash flows so they can sustain themselves through a period of time here. The big question is, how long is this going to last? And that's where it's going to see, where we could see the most dramatic impacts. Is this going to last 2 weeks, 3 weeks, a month, 6 months, right? Those are some of the big concerns I think business is wrestling with right now.
Right, and we'll come back and talk about that a little more specifically. Let's go back to you, Major General Quinn. Can you tell us what is the state doing to try to help offset this economic disruption for businesses and employees?
So I think there's a couple things that you've seen directives out of Governor Bullock. One is the unemployment insurance, and so the waiver of the 1 week delay for uninsurance to get checks into those individuals' hands if they've been laid off due to COVID-19. They're eligible for unemployment insurance. And then also for the businesses across there, Small Business Administration came out. I know there's been great interest across Montana that Department of Commerce is working through for Small Business Administration loans to those businesses that have been affected. Todd's absolutely correct. There is an effect that's having on businesses, and we're certainly aware of that.
And so right now, for employees of the businesses, you're making sure that unemployment benefits are available as quickly and as much as possible.
Absolutely. They relied on that paycheck that was going to come at the end of this week. They need to be able to rely on that uninsurance or unemployment check coming at the end of the week as well. And that's what that waiver of the 1 week delay that Governor Bullock took is to get that check into those employees' hands as soon as possible.
We also mentioned the school closures, and also Todd mentioned about people suddenly having to have children who are not in school and who are home or wherever they're going to be. Is there anything you can tell them about, anything the state's doing or anything anyone's doing to help them deal with that changed situation?
I think the state and employers are working together to try to find ways to allow that. There are single parents that are needing to stay home with kids that oftentimes are in the service industry or working in other businesses or in state government, city government. And each of those organizations at the state level, at the municipal level, or within the businesses, I know across Montana, are working to try to find ways for those parents to be able to stay home with their children.
Todd, I want to go back to you. You've heard what Major General Quinn has said about what the state's doing. I'm wondering, is that enough? What more might businesses be looking for from government, state or federal for that matter? You know, Congress has passed two big bills, or one big bill, having to do more with businesses, working on a much larger package now. What's your recommendation on what should be done or can be done?
Well, I think the business community is frankly in a bit of a state of shock right now. I mean, this has evolved and escalated so quickly in the state of Montana that I don't know if the business community knows what the right answer is as far as assistance is concerned. You know, the governor has made some excellent steps as far as his declaration of the state of emergency, which allowed for adjustments to be made for unemployment insurance. That is probably the most important immediate step that that the state and the federal government can do with regard to this. But longer term, I think it's going to take some time, quite frankly, for the business community and business leaders to really understand what the long-term implications are. Keep in mind that a week ago Friday, parents were picking up their kids from school. There was discussion and there was talk that these kids might not be going to school at some point in the next week. On Monday morning, employers were suddenly getting phone calls from their employees saying, geez, you know, I need to stay home with my kids. And so that's such a sudden shock and a change for a business to have to suddenly try to figure out how to accommodate their workplace with some of the challenges that they're facing. 4 weeks ago, the stock market was approaching another all-time record high.
29,000.
Right,
yeah.
and now we're down 10,000 points. And so the speed at which this has rolled into Montana and as quickly as it's escalated, I think the business community is dealing with how to respond with what's facing them immediately. And it's difficult for them to try to look ahead to see how long is this going to be, what's another shoe that could drop, how do we prepare ourselves, and what sort of immediate assistance do we need?
Now, some of the things being talked about in Washington, D.C., you know, checks sent out to people directly, and also some other things to help business. Are any of those things that look positive at this point? Of course, it's all kind of fluid at this point. We won't really know that until later this week what it's going to look like. But is there anything in there that you have heard about or point to and say, this could be a good idea?
Well, it's difficult. Like I said at the beginning here, you know, I think businesses are struggling to figure out what it is exactly they're going to need. You know, there's talk about the Small Business Administration having low interest loans. There's a limit to what that's going to be able to do because a lot of businesses are already bearing low interest rate loans. And so an additional loan is probably not going to be of great assistance to them, especially, you know, if they're looking at a situation where they've got no income coming in and they don't know how long that's going to last. And so I think that there's an immediate reaction that Congress is trying to take to address this thing immediately. I think there's going to be a longer term sort of an approach that's going to have to come from Congress in order to deal with this after we have a little better idea of how long this is going to last and what sort of additional shutdowns and foreclosure or closures that we may see in the state of Montana.
Okay. I want to go back to Major General Quinn here and talk about something, an aspect of tracking and treating the disease. Of course, we're talking about first about the testing for COVID-19. Last week, I think we had about 700 tests left and possibly 1,000 more on the way. What's the status of available test kits? Why is that important?
Well, it's important because that's the way we're going to know where COVID-19 is, right? And who's got COVID-19. Most important for those patients that are in a hospital and to our frontline individuals that are out there, police, EMS, firefighters, and doctors and nurses that are going to be treating patients. That's where the tests become most important. We have test kits. More test kits have come in. They continue to come in, and the state continues to order them. We also have private labs that are coming online, and the CDC, Centers for Disease Control, has enabled more private labs to come online, and so there's options for that as well. But when we talk about test kits, we also have to talk about the swabs that are being used by the medical providers to be able to get that test over to the state of Montana or to the private lab, and the medium in which that's transported. And so there's a lot of factors that we have to weigh into the availability of tests, not just the physical test kit itself.
So at this point, though, do we have enough tests that we'd like to have? Is there a shortage right now in Montana? We
have enough tests that we need to have right now. Again, as this continues, we're going to continue to order more tests, and again with the private labs coming online, I think we're looking okay there. One concern that we continue to address, Mike, is those the swabs and that medium that we need to ensure that the hospitals across the state have.
Okay. And so who is being tested? Who can be tested? Who should be tested?
And I know it first came out that anybody that wants to get tested can go get tested, and that's really not what we want to be doing. So we need to look at those primarily individuals that might be hospitalized, that need the test, but also individuals that show the symptoms. And the symptoms, as has been talked about, is a fever, flu-like symptoms, respiratory distress. I mean, those are the cases where they'll want to call their medical provider and talk through those. And then the medical provider is going to want to know, was there direct contact with a known COVID-19 positive case before? That's really what would drive that test. And it's up to that medical provider to say, yes or no, I believe you should be tested. And when the medical provider says, we want to test you, that's where the state lab or private labs then come into play, and they're running the tests.
So you essentially need to get approval from a physician or from a medical professional to get the test. And what about if you think you've come into contact with someone who had the disease or is close to someone who had the disease? Is that enough reason to say, I want to be tested?
Well, again, I think what the medical provider would look at, and that's talking to the local county health department or whichever county health department you believe you might have come in contact with that individual. That medical provider is the best person to say, yep, let's get you a test, or let's test and see maybe you've got flu or you've got the cold, and rule those out and then look at the COVID-19 test.
Okay. And as far as paying for these tests, how much do they cost? Are there any sort of things being done to help people pay whatever they need to pay?
Yeah, Mike, thanks for that. So Governor Bullock has rolled out that those uninsured, those tests will be free. And the 4 large insurance companies of Montana have all come online and said those tests will be free as well. So people do not need to worry about paying for the test. Again, it's a matter of if the doctor orders the test or their medical provider orders the test, then the test will be conducted.
And one last question here, kind of a clinical nature. What are the symptoms that people should be looking out for to possibly go get tested or to know that they may have contracted this?
Yeah, the most common symptoms are flu-like symptoms, and that's what makes it a little bit difficult because it's mirroring the flu. Cold-like symptoms as well. Fever is a good indicator, and then shortness of breath is another indicator that individuals need to look at. And that's, again, where the doctor will hear what the symptoms are and then walk through those procedures.
Okay. Now we're going to switch gears just a little bit here and go back to Todd. As this epidemic unfolds, are businesses being consulted or properly informed to the level that they'd like to be on what's going on or what they should do or how they can be helped? What do you think?
Well, I don't know that there's time, frankly. As these decisions are being formulated, they're being formulated by health professionals. And so to be able to reach out to the business community on a minute-by-minute basis is really difficult to do. And so I think the business community understands that this is a rapidly evolving situation, and that they're willing to do their part on this sort of thing. And so I think there's an understanding, an acceptance for what's going on, recognizing that you can't communicate when a series of health professionals make a decision, that it's difficult to be able to get the word out in time. I think the big piece for the business community is that we'd like to see this end sooner than possible, sooner than
as soon as possible.
As soon as possible.
Yes.
Thanks, Mike.
Yeah.
As soon as possible. And I think if the public will take the steps that are being recommended through our health professionals and social distancing and some of the steps that we're taking in the businesses, I think there is that chance that we'll be able to see this end as soon as possible. And I think that's going to be the best thing that we can do for the business community, is get on with life as normal if we can get ahead of this thing as quick as we possibly can.
I don't know if this is a fair question or not, but how long can businesses withstand these types of restrictions? In other words, how long can they go without customers, without cash flow?
Yeah, that's a good question, and it's going to be business dependent and industry dependent. Everyone is going to have certain sort of circumstances that are unique to them. Some of these businesses aren't going to be able to last more than a few days without any sort of income coming in. as far as customers. Some have been able to build up reserves and can last a little bit longer. So it's going to be kind of business by business and industry specific as far as what those impacts are going to be as far as their longevity.
And this is another question I think is kind of hard to answer, but I'll ask it anyways, and that is there anything that Montanans, citizens can do on their own to help sustain local businesses in this downturn and this climate?
Yeah, this is a great time to buy locally, and this is one of the things that we've been encouraging, and I know the local chambers around the state of Montana have really been encouraging folks to take this opportunity to really focus on purchasing local. You know, think about not just, you know, your grocery store and your restaurants, but think about even the sole proprietor businesses, your beauticians and your nail salons and all the small businesses that you have in your community, and perhaps use this as an opportunity to buy gift certificates that, you know, that you can give to your friends and neighbors and family that they can utilize when those businesses are more safe to be able to go to. So this is a really good time to focus on buying locally, and I think that's one of the best things that the citizens of Montana can do to support the local communities.
So you can take your Amazon Prime and just kind of shelve it for a while here, and maybe buy locally.
Right.
Major General, let's talk about also what citizens can do first and foremost to help slow the spread of the disease. We talked about this a little bit already. We talked about social distancing. Anything we haven't talked about that they should be thinking about as far as doing their part?
Well, again, I think it's personal care and it's public care is how I would phrase it. So social distancing is that public care. But I agree with Todd. Now it's a great time to shop local and to continue to support the businesses that are out there that every day we rely on and maybe need us now more than ever. But it's also private care too, personal care. And that's the recommendations that are out there for hand washing and proper hygiene. That's so important right now to ensure that we don't spread this disease and to continue to spread it amongst others. Social distancing works, but again, if we're confined within a home, we need to make sure we protect each other, and that's through proper hygiene.
And another thing that kind of crosses both your paths in terms of what's going on out there, and that is the stockpiling of certain goods that people are going to the grocery store and just buying tons of hand sanitizer, toilet paper, whatever. What advice would you give here? I know I've seen people saying you don't need to do that. What's your advice here?
Well, again, I think our market economy is a good market economy, and we have the resources necessary. I don't think anybody needs to hoard, and it is a little disappointing because there may be those who are more at risk from COVID-19 that aren't able to get out and hoard. And so I would encourage everybody in moderation, make sure you have the supplies necessary, and our Disaster and Emergency Services always talks about an emergency kit, but that emergency kit doesn't necessarily include a closet full of toilet paper. So I would say just be aware of that and help your neighbor out and be aware of your neighbor. I think that's what's most important.
Anything you would add to that, Todd, as far as the people buying stuff that they may not need at this point?
Yeah, I think if we would all go back to buying what we normally buy at the time that we normally buy it, there'll be plenty to go around for everyone. It's shocking to go into the grocery stores and see shelves barren of some of the normal products that we have. So if we just go back to buying what we need when we need it, there'll be plenty to go around.
Okay. Now, one thing that Todd has mentioned many times during our conversation is how long is this going to last? And Major General Quinn, I mean, I imagine that's really a question you can't answer at this point, but is there anything you can tell us and say, okay, is this going to be a month, 2 months, a few weeks, 6 months? Can anyone answer that question at this point?
I don't think anybody can answer that question, Mike. I think a lot depends on the social response to what we're recommending. If they don't take into the recommendations into account, the recommendations, this could go on longer. And that's why Governor's been very clear about what we all need to do as individuals and as a public to try to limit this thing and bring it back under control.
And if we don't do what we're supposed to do and things get worse, you know, what sort of steps are we looking at in the future? Can we talk about that at all?
I think everything's going to be on the table at a national level and at a state level and at a local level. I think each one is going to have to look and try to make a determination what would be best to try to corral this thing and limit the exposure. If we don't do what we need to be doing, this could go on for a long time. And then let's talk about the businesses and the impact on the businesses across Montana.
Speaking of which, Todd, I'm just wondering, once things do return to normal, however long that's going to be, I don't imagine that businesses can just who have been closed and just throw open their doors and pick up right where they left off? Or can they? I mean, there's going to be a transition period. What can we expect? Is it possible that some businesses are not going to be able to reopen?
Well, we hope not. And again, it's going to be a little bit business and industry specific. You know, my wife's in the catering business, and she's seen a number of events for her that she had booked that were canceled over the coming months. Well, once we get back to a period of time of normalcy, right, there's going to be a lag in some of those events being rescheduled. So restaurants and bars and some of those sort of things, I think there's going to be a resurgence relatively quickly. Some other businesses may take a little bit longer for them to get kind of back to somewhat of a state of normal. What we're hoping will happen through this is that once we get back to normal, there'll be a little bit of a pent-up demand, if you will. There'll be a real hunger for folks to get out and start enjoying life again, and that we'll be able to see businesses start thriving again once we get back to a place of normalcy.
And as you said, the key really is how long is this going to be?
Right.
And that's the one thing I'm sure everyone is really wondering. Now, I think there's a feeling from some out there that that this is being blown out of proportion, that we're overreacting, and in the process creating severe economic harm that may not be necessary. First, Major General Quinn, could you address that? I mean, is there a possibility we are overreacting? What do you say to people who advance that theory?
You know, as I watch this, Mike, spread across Montana, this is not an overreaction, and nobody would want to put businesses and schools in the place where we're putting them as an overreaction. This is a cautionary step that we have to do to ensure that we contain this virus. This virus is deadly. It is killing people across this nation and across the world, and we need to take this very, very seriously and ensure that we can limit this exposure across Montana.
And Todd, what are you saying to your members and members of the public who are saying, hey, people are going way overboard in this. This is killing us. What do you say to them?
Well, we don't think it's an overreaction. I think the goal is that we're wanting to flatten this curve, right? I mean, that's the big push, is how do you flatten this sort of a curve? And so we don't think that there's an overreaction. At the end of the day, I guess you look back and you say, maybe we overreact a little bit, and it's better to overreact than underreact and have much more serious consequences to the public than what we did, because we took such aggressive steps. So I think the business community accepts this, and they're doing their part to try to address these sort of issues and try to stem this thing off before it gets any worse than it does.
Okay. With that, we're going to wrap up our show. I'd like to thank my guests, Todd O'Hare from the Montana Chamber of Commerce, Major General Matthew Quinn, who is chairing the Governor's Task Force on COVID-19. And I'd like to thank our viewers for joining us this morning, and we'll see how we can ride this one out. And I'm Mike Dennison. Thank you for joining us on Face the State. People can find the most current updated information on the website covid19.mt.gov.